So what can be removed here in clinic? There are so many lumps and bumps, and often people don't realise that it's a simple procedure. It makes me laugh because patients will come and have one thing removed, and often the response will be like, oh, I didn't realise that would be so easy and quick. Here I've got a million more that I'd like to have taken off. So the kind of things we're looking at are simple skin tags, which are benign little lesions that often occur in areas of friction, so underarms, under bra straps, waistlines, sometimes around the neck where the necklace rubs. Easily removed and very quick, painless and very minimal scarring. Other bumps such as lipoma, which are fatty lumps, can be removed, as can be sebaceous cysts. These are a little bit more involved, so often require stitching, but you can rest assured that a 20-minute procedure, they'll be gone and you will just be left with a small little line where it once was. Stitches also will be removed by ourselves a week later, so you don't have to be worried about bothering your own GP. It will all be dealt with in-house. Other lesions that can be removed are seborrhoeic warts, which happen to be sort of flat, sort of almost sit on the surface. They're quite dry, warty looking. Often people will find that they get a lot as they get older, and these are simply scraped off and easy to remove and very satisfying for the patient because they can be dealt with very quickly. Sometimes patients will come to see me wanting a mole removed. Now this I have to be a little bit more careful because it's really essential that we make sure we know exactly what we're dealing with before we remove it. So if I have a mole, I will always examine it first of all to make sure that there isn't anything suspicious. 9 times out of 10, I will also recommend that you have it sent off for pathology, just so that we get that lovely peace of mind a couple of weeks later that we know it was nothing to worry about. So moles are usually removed with an excision, so a proper surgical procedure, but under a local anaesthetic, all you will ever feel is a tiny sting. We'll remove the mole with a good margin, and then we will use stitches to close the wound. The stitches will be removed about a week later, and then you'll just be left with a small little line where the mole once was.